Hi, this is my presentation for the Open Life Science program. I'll begin with a little bit about me. My name is Tasneem Khan, and I'm a PhD candidate at the University of Waterloo School of Public Health Sciences. My research mainly focuses on social and health inequities and the mental health of underserved populations. In this presentation, I will first provide you a brief background on my Alliance/OLS project, and then discuss the goals and expectations that I had set out at the beginning of the OLS program, followed by discussing a little bit about my journey and the goals that I have achieved. Lastly, I will discuss some next steps for my project in light of the OLS training. My project is related to Statistics Canada datasets and accessibility to the research data centers for people belonging to equity-deserving groups, and this includes immigrants, parents, and those identifying with a physical disability, as well as those who are neurodivergent. The project has two parts. One is related to quantitative research, in which I'm extracting information from StatCan surveys, including the census, the Canadian Survey on Disability, as well as the Canadian Community Health Survey, and I'm extracting information on EDIA dimensions. And the second part is to interview researchers on their experiences of accessing the research data centers. There were two main motivations for carrying out this project. The first motivation was that Statistics Canada data are complex, and not much is known or compiled publicly on the EDIA potential of these data. Secondly, there's limited knowledge on the potential strengths as well as the barriers in accessing and the use of the data centers, especially for people from equity-deserving groups. My OLS specific goals in relation to the project involved learning about community and personal management. The project does involve working with members of the central team of the Canadian Research Data Center Network. They're one of the main organizations that facilitates data access to academics at the StatCan centers. I also wanted to know more about openly sharing my work while maintaining ethics and integrity. I applied my OLS training by maintaining transparency and connection with the CRDCN team. I gained their feedback on both the quantitative as well as the qualitative parts of the study and incorporated it into the documents. And I think the code of conduct document really helped me setting up the stage for the project and thinking more about the roles of the members of the team. And in the training, we also learned about including partners and empowering the community while also maintaining a sense of direction for the project. So I had to do that by keeping the scope of the project within the timeline. There have been a few milestones for the project. So the first was the completion of a draft of the resource document for the researchers, and I've sent it over to the CRDCN team for review. And the second was the framework document, which the CRDCN team can use to replicate extracting information from future surveys. And then I also completed the ethics application for the qualitative part of the project, and the hope is to begin interviews as soon as I receive ethics clearance. And then in specific to OLS, I learned how to use a license for sharing documents publicly, and that was something new for me. The next steps include incorporating more open sharing practices into the project. So the first would be to publicly share the resource document or its components for researchers to use in some format once the CRDCN team approves it. The second is the qualitative report, which was initially intended to be an internal report, kind of a bit to learn more about the experiences of people internally. However, it may be possible to share a bit publicly once the CRDCN reviews that report, and if there's a possibility to share it, that will be done. Then lastly, the pre-registration of the qualitative research on the OSF repository is something that I'm considering based on the recommendation of my OLS mentor. I want to thank everyone who has made this project happen and move forward. That includes the Digital Research Alliance of Canada, of course, as well as Open Life Science for providing us with this training, and to the CRDCN Central team for their collaboration and input on the documents, as well as my mentors, including Eunice Machado Lara from OLS and Professor Martin Cook from the University of Waterloo, and lastly, Statistics Canada for providing the survey documentation online and openly.